Let's get the latest health news now with Norman Swan, host of Radio National's Health Report and What's That Rash? This week, Norman has a few suggestions on how we can age well.
So this is a study of 2 million people followed for many years through to about the age of 90 in 39 countries, 6 continents. So a lot of variety in there in those groups of people. And what they did was they looked at them 50 and what predicted their healthy lifespan, in other words, their healthy years of life. And they looked at 5 risk factors in particular. So they looked at smoking, high blood pressure, high cholesterol, overweight and underweight. So underweight as well as overweight are risk factors, and diabetes. So they looked at those risk factors. Now, if you had none of those risk factors at age 50 and you were a woman, you lived 14 years longer than women who had those risk factors.
Wow.
And if you were a man, it was 12 years longer. So this is pretty powerful stuff. And these 5 risk factors, by the way, only explain 50% of the coronary risk factors. There's another 50% out there, which they did measure, but they were not consistently, so they didn't include it in the study. But those are things that we already know about, which is physical activity, how well you eat, and so on. So these are really extraordinary figures. And what they showed also was that if you look at these risk factors, they weren't all equal. So high blood pressure was really potent in terms of years gained, years lost, as was smoking. But smoking rates have gone down internationally, so blood pressure has kind of risen to the surface as the most important risk factor. And the good news is these are risk factors that you can do something about.
Yeah, you can manage them, indeed. And is there any idea of what is going to be done with this report?
Well, it allows people to, first of all, it's not just saving your life from, say, heart attack and stroke. It was all causes of premature death were preserved. So something like smoking and obesity are related to cancer as well. So these risk factors affect much more than just the state of your arteries, and they'll affect dementia too. So it really just gives power to people to know that in midlife, you really want to know what all those risk factors are and do what you can about many of them with your general practitioner.
Get on top of them, indeed. Now, further to this, Norman, last week the Australian Institute of Health and Welfare released data on multi-morbidity, and that is the number of Australians living with 2 or more chronic conditions. What did it find?
It was a high number. So it's 40% of Australians, about 9.7 million people, are living with 2 or more conditions that are going to be with them for the rest of their life that aren't easily curable. It doesn't necessarily mean that their life is a misery with them, but they've certainly got 2 or more. And in children, it's 11% have 2 or more. So these are things in children like ADHD, autism spectrum disorder, asthma, diabetes, and so on. And in adults, it's things that we've been just talking about. It's coronary heart disease, it can be cancer, but also can be osteoarthritis and dementia. So, but the burden is high in the community, and just worth knowing. And those risk factors that we were talking about earlier prevent many of these multimorbidities, and you live a happier, healthier life.
That's what we all aim for. A really fascinating story last week was that mitochondrial donation story. Did you do an explainer? Do you have any more on that?
Well, just to explain, because I think there's a bit of misunderstanding about how this works, is that because people say, well, so mitochondrial disease can be devastating, devastating heart problems in the baby, there can be blindness and other problems as well. And if you can prevent them, that would be a good thing. Now, people say, well, why can't you just do pre-implantation genetic testing, which is what they do for other inherited disorders? And the problem there is that pre-implantation genetic testing only works. So you've got the DNA in these mitochondria, which are in the soup of the cell, around the nucleus, which is where most of the genetic material is that define you as a person. But in the soup of the cell, there are these little energy factories called mitochondria. And the DNA in that comes from the mother. And you can test the DNA in that, but if you've got a very high rate of mutation in that DNA, pre-implantation genetic testing doesn't help you. You've got to actually do the donation to preserve to actually protect the baby. So how this works is, and it's not guaranteed, by the way, because you've got to be able to take the nucleus out of a fertilized egg and transfer it into another fertilized egg. So the mother and father do IVF, they get a fertilized egg, then a donor has a fertilized egg with a partner, and then they take, because these mitochondria are in the soup of the cell, they take the nucleus out of the donor egg, fertilized egg, they take the nucleus out of the mother's egg and transfer it into the fertilized egg of the donor, so that you leave the mutated mitochondria in the donor, in the mother's egg. There is a problem. You can accidentally take some mitochondrial DNA with the nucleus, so it's hard to do and it's not a guarantee, but it does, according to this paper published last week. They had, I think, 8 babies with no signs of mitochondrial disease. So this is really something that's quite special. And this way of doing it with fertilized eggs solves some of the ethical problems that people have with other techniques.